Talking about the Oncodaily, it was established last year. Less than half a year, it became one of the leading oncology media platforms globally.
Welcome to Caring and Sharing, the Advanced Oncology podcast. My name is Uta Spitz-Straßburger, and I am meeting Gevorg Tamamyan from Armenia today. Hello.
Hi, Uta.
Let me introduce you first to our listeners. You are the head of the Pediatric Cancer and Blood Disorders Center of Armenia. You are chairman and professor of the Department of Hematology and Pediatric Oncology of Yerevan State Medical University, and you are the CEO of the Immune Oncology Research Institute in Yerevan. You are currently also president-elect of the Pediatric Oncology East and Mediterranean Group, and you are editor-in-chief of Oncodaily. On top of all that, you are a previous student of ours of the Advanced Oncology Study Program. You have studied from 2013 to 2015, so it's been almost 10 years, and it seems that you made quite the successful career. So congratulations on that. But I'm curious to learn about Oncodaily, which seems to be the latest kid on the oncology blogs.
First of all, thank you very much for having me on your inaugural program. And it's really an honor. Ulm University and definitely Master in Advanced Oncology program has a special place in my heart. And although I graduated in 2015, since that time, it's almost 10 years, but because of your kind efforts, I have been always in touch with the program, lecturing, and then also getting your advice as a mentor and so on. So I'm really privileged to be part of the program, and it's really an honor to be here today. Talking about the Oncodaily, it was established last year in May. We started basically run it from the beginning of June, and in less than half a year, it became one of the leading oncology media platforms globally. Not just like locally or so, but globally it became one of the leading platforms and also one of the fastest growing. I'm happy for that, of course.
Congratulations. So when I checked on oncodaily.com, first I perceived it as a blog, but you were, I think, quite unhappy with me saying that it is a blog. So you said it is so much more. Can you please elaborate what Oncodaily does encompass?
It's not that I was not happy. It's just like it was not the whole story. Yeah, it has a blog, but it's a big media platform. It has blog. It features a lot of news, insights, opinions from all over the world, from professionals, from patients, from patient advocates, from the industry, from academia, from healthcare professionals, NGOs. So basically from all stakeholders, bringing all the news together and featuring the same platform. Besides that, it has these dialogues with, again, the stakeholders in the oncology field. These are these video interviews, basically like podcasts. And besides that, it's going to open soon the Scientific Medical Journal, and it's going to open the magazine. Besides that, we are doing events, and I think they are quite well received. The later one, what we did, the last one, it was in December in collaboration with the Institute of Cancer and Crisis, which was the first global summit on war and cancer dedicated to the issues of oncology in the conflict-affected regions. So it was the inaugural event on that topic. And it was very well attended, or like more than 90% of the main key opinion leaders presented there. We were honored to have the WHO Director General to give an opening address for the event, and Her Royal Highness Princess Tina Mired of Jordan giving an opening address and very actively participating in the event. And we had more than 50 countries present there. And it was our first basically event, what we did, and it was really very well received. And we are planning far more For example, in February, we are doing GI Cancer Summit, and in April, which are planned already, like in April, we are doing head and neck cancer and so on. So we will have the Global Cancer Influencers Congress.
Thank you. This sounds really exciting. What I liked best when I came to the website was that it is so easy to handle. So I can choose according to my preferences. And what I also saw on social media was that you feature people from all over the world. So you are a rather inclusive bunch of people. And I think this makes a big difference when it comes to, you use the term already, key opinion leaders, because I think many people on the working floor see just that. They see their patients and the working floor, and they rarely ever have room to breathe. So I think it is a nice touch, or maybe even a strategy, to incorporate people from all over the world. So was that intentional?
Yes, basically, when we were starting the Oncodaily, one of our goals was to be maximally inclusive, because the other media platforms which exist in general, not in oncology, but in general, they are very focused in certain areas. Let's say United States, Canada, Europe, Asia. Some of the platforms, they are taking themselves as global, but if you go there, I mean, you rather find maximum, let's say 100, 200 people who are the main contributors, and that's all, maximum. But I can proudly say that within 6 months, I think we featured more than 1,000 people already on the platform. I mean, it's a big work, of course. We need to find, first of all this news, and I mean, select them and bring them to the front, spotlight them. So, but it's good that we're kind of trying to bring the positive feelings to the people globally, not just to the certain geographic areas. And that's why we are trying to be maximally global. And our motto is the voice of oncology. We are trying to be the voice of people in oncology globally.
So how do you find the people?
So our main focus is social media. It helps a lot. Before the social media era, it was very difficult to find people, to kind of find their opinion. But nowadays, I mean, on social media, you can find anyone, or like most of the people, at least, and from everywhere. So we kind of follow the people, we curate the news, we select those which I mean, our team likes and our team thinks that people would like to read about it or listen about it. So, and we see that with our growth and with our progress, we see that people really like what we are doing.
How do you ensure that the information that you are covering is proper information, so that there are no fake news? Because social media does bear with it also the risk of these so-called fake news, however you want to call the fakes, but there is also a certain discussion about the quality of information that is being shared on social media as compared to, say, a peer-reviewed journal.
I agree with you that it's difficult, of course, but we have more than 20 people working on that. And we have several layers of checking the things, what we are publishing. Of course, there might be some mistakes, as everywhere. As you mentioned, peer-reviewed journals, but today we see that even some most famous peer-reviewed journals, they are retracting their papers. I mean, anywhere can be some mistakes, but we put several layers, we put a lot of people working on that. So we are trying our best to make it as clean and clear as it is possible.
So I think so far you're doing an incredible job. So thanks a lot for all the effort to everyone who is involved.
Thank
so you are chairing it. And I think it's your positivity that is probably very contagious to your entire team. But I think we must state here also that it is a team effort. And I like your slogan very much. Can you say what the slogan is?
So basically, our slogan is "Cancer does not take a day off, neither do we."
So I like that quite a lot because it sensitizes you for the matter. On the other hand, I think it is important that you do take at least a little time off. So how do you manage work-life balance?
Oh, this is a difficult question, and you need to ask this question to my wife. Do I balance or not? But I'm trying my best. Certainly, I dedicate a lot of time to the family, and I'm trying to dedicate more time to the family and to the friends. But I love what I'm doing. So there is no basically a border between them, work life. So it's really intermixed.
You're living your best life. That's it.
I'm trying.
As you said, you gained a very considerable visibility already on LinkedIn. Would you like to boast a little bit?
Oh yeah, of course. That's I like to do. No, really, I don't like to boast, but I'd like to show some progress what we did with the Oncodaily within 6 months and on the LinkedIn with our total engagement metrics, and I published it recently, it went up really, and it was much more than many well-established, like 100 years old media channels, not in oncology field only, but globally. And I mean, it's very visible. So it means people are reading us. It means people like what we are doing. And LinkedIn is a huge platform with 1 billion people almost. But we are not only in LinkedIn, we are also on X, formerly known as Twitter. We just recently started also on the Meta, Facebook. So it's growing, and we are going to cover the other social media as well. I'm not very familiar with all the social medias, but at least like LinkedIn is considered a professional community. And we had some good success over there, and I think on the X as well.
Yes, so I think it does make sense to share professional news on a professional platform. So I think you did the right thing. And if it spills a little bit over into other platforms, why not?
Yeah, but in the future, we are planning also to provide a lot of information also for the patient community, for the patient advocates, for which we would use Facebook, Instagram, and etc.
So we are already at the end of this episode. Thanks a lot for joining us today. I hope that our listeners will check at least into the Oncodaily, and that there will be more than one who will check it on a more regular basis. Thanks a lot for joining me today, and wishing you all the best. And I hope that even if you don't spend a lot of time with your family, but that the time that you're spending is of high quality, and that you're there with your entire heart.
Thank you very much.
Thanks a lot.